very pleased to be able to introduce Yuki to give her science talk.
So I have been asked to give a lecture on a topic related to behavior analysis, which is a discipline that I'm trained in, which is also the basis of the contingency management. So you'll all learn something very fundamental about contingency management today. So I picked the topic on reinforcement because this is the fundamental concept in behavior analysis. Okay? Today I'd like to cover 3 main points: positive reinforcement, negative reinforcement, and how the principle of reinforcement applies to health problems, including drug addiction. If you have any question, you can stop me and ask me questions anytime. I'm trying to make this class as interactive as possible. Okay? So, So behavior analysis is all about how to use the environmental stimuli to change behavior of individuals. Could it be human beings, rats, pigeons, single-cell organism like planaria, even cellular response. But before thinking about how to change behavior, we have to define what is behavior. So could you say 1 or 2 words, what you think, what is behavior to you and how you define behavior?
It's observable.
Mm-hmm. Very good. Anything else? Maybe one more response. Movement. Cool. So behavior is generally defined as a muscular, glandular, electrical activity. Can be interchangeably used with the term response. Anything a dead man cannot do is a behavioral definition. So let's do some exercise. Dead man cannot walk. So walking is a behavioral definition. What about jumping over a cliff? What do you think? Is that a behavioral? Or can dead men do jumping over a cliff? Or no, it requires some muscular activity. So jumping over a cliff is a behavioral definition. What about falling over a cliff? Falling over a cliff. It's something you can push, something over and it falls. So it is not it is something dead man can do, so it's not a behavioral definition. Talking, dead man cannot talk. Thinking, dead man could look like thinking if he's in the right pose. What distinguishes in the components of thinking, what distinguishes live person thinking from dead person thinking? What would be the difference between live person thinking? Huh?
Brain activity.
Very good. Anything else? Back in the day when we didn't have an MRI device and so forth, oftentimes we relied on writing activity. If someone is thinking, they can produce something as a result. That's the difference. And we could also focus on neuron firing. If you are doing something, somewhere in your brain, neurons are firing all the time. So you could focus on neuron firing as the focus of the study. And sleeping is another good thing. Dead man is very good at being in bed. But what distinguishes a live person sleeping from dead person sleeping? Breathing. Very good, very good. That's something we can measure even without MRI machine. So that's good. So now you know how important it is to be concrete and specific when you define behavior. So something like eating a pizza slice, we pass the dead man test because dead man cannot eat pizza slice. But we could go further. We often use this activity called the task analysis to break down eating pizza slice behavior into even more specific components, such as taking a pizza out of box, cutting pizza pie into slices and picking up a pizza slice and bring it to the mouth and chew them. So you see that eating pizza slice could involve multiple, more specific components. Okay? So now you have an idea of how to define behavior. So let's talk about how to change behavior. Roughly speaking, when we talk about changing behavior, it's either to increase or decrease. And usually, in a world of behavior analysis, we consider that there's some change happens in the environment after behavior occurs. So consequential stimulus is either presented or removed. When a consequence is presented, some stimulus is presented as a consequence after behavior occurs, as a result, behavior increases in the future, we call that as a positive reinforcement contingency. I use the term contingency to describe the relationship between behavior and some change in the environment. Okay? So let's take an example of positive reinforcement contingency. There's no attention prior to my son, Koichi cries, and he cried, and he gets attention from my husband. And crying behavior increases in the future as a result. So this is a very simple, clear-cut example of positive reinforcement contingency. So can you think of some example from your daily life that might be considered as positive reinforcement contingency?
I've been knowing cat that cries.
Cries, and what happens after cat cries?
He normally gets attention as well.
And then the crying behavior increases in the future?
It seems like it.
It seems like it. So that would be an example of positive reinforcement contingency. And then, if behavior occurs and some stimulus or condition is removed as a consequence, we call that as a negative reinforcement contingency. It sounds counterintuitive, negative, but reinforcement. So negative part is really talking about the consequence part. Some condition is removed after behavior occurs. And as a result, behavior increases in the future, so that's a reinforcement contingency. So, an example, my mom is nagging for me to study math. So I study math and she stops nagging. As a result, studying math behavior increases in the future. So you see some aversive condition is happening already, and I do something, and then it stops. Then my studying math behavior increases in the future. So this is an example of negative reinforcement contingency. Can you think of some example of negative reinforcement contingency from your daily life? Maybe we all study hard under the threat of deadlines. IRB is coming up, enemies on your, on you, and you have to do something in order to submit something. And then now the threat of deadline is over because you submitted something. We are all under that contingency constantly. Okay, so that would be an example. So I cannot emphasize enough the importance of this phrase. Reinforcement always increases behavior. So I want you to say after me together so that you remain awake. Reinforcement always increases behavior, okay? Now, I wouldn't go into the other two contingencies today, but there are two other contingencies to decrease behavior. Either positive punishment contingency, this would be like you're given shock, so you stop pressing lever. Negative reinforcement is equivalent to penalty. So you park your car and you have to pay a ticket, you lose money, so you're less likely to park your car in the future. So punishment contingencies are always to decrease behavior, okay? These behavioral contingencies are a universal principle across species. Human beings, primates, rats, pigeon, mice, planaria, cells, immune system. You can apply the same approach contingencies to behavior response of all this. When you study animals, we often use this box called the Skinner's box or operant chamber. There are lights for pigeon to peck, and there are bars for mice, rats to press. Hello. And there's a place to eat food called the Food Magazine. He is a founder of behavior analysis, B.F. Skinner, putting a pigeon into the box, and now he's ready to peck keys, just like that. Okay? So I just want to point out one more thing about contingencies. One behavior could be under multiple contingencies. So Koichi's crying behavior may be maintained by attention, but also could be maintained by the stimulation, tactile stimulation from hugging or cookies. So just just because you remove attention contingency doesn't mean Koichi crying behavior decreases in the future. It could still be maintained by other reinforcement contingencies, just to point out. Okay? So I want to do some exercise to see if the following items on the slides function as a reinforcer to you guys. So raise your hand. Would you study more if you get sushi? Okay, so for those of you who raise your hands, sushi is a reinforcer for you. Okay, so use that for your sake in the future. What about money? Would you say more? Everybody likes money. But think of a situation where you are in like on an island, okay, and there's no machine or a place to exchange U.S. dollars, and you can't use the U.S. dollar currency on the island. And now, money just becomes just a piece of paper, and it loses reinforcing value. So I just want to point out that the something that's very reinforcing, powerfully reinforcing, could lose its effect depending on the context. Okay. What about loud noise? Does anybody like loud noise? No. But we would all love it if the loud noise is being removed. So loud noise is something that you can use in the context of negative reinforcement contingency. Okay? Yelling. Does anybody like yelling? No, we all don't like to be yelled at. But what about a child who never gets paid attention to by their parents? And they act out, and parents finally pay attention, but at the same time yell at them. So now yelling is directly associated with parental attention, and to those children, yelling it might not be so bad and might maintain certain behavior. So I talked about how important to be specific when you define behavior, but there are other factors that influence the effect of reinforcer on behavior, including how deprived are you with the reinforcer, how probable the contingency is, and usually the bigger the magnitude of reinforcer is, the more effective the reinforcer is on behavior. And we're going to zoom into this last component, delay, to present a reinforcer. Usually the longer the delay is between behavior and a consequence or the reinforcer presentation, less effective the reinforcer is going to be on behavior. In case of animals, more than a minute delay before presenting a reinforcer kills the effect of any reinforcer on animals' behavior. So focus on delay to a reinforcer. Racklin and Green did a series of studies with pigeons starting in 1972, studying this component, delay to a reinforcer. So pigeons were presented with two keys. Left key, if pigeon pecked the left key, food was presented immediately, but for only 2 seconds. If the pigeon pecks the right key, the food is presented after 4 seconds of delay. And however, they have a longer access, 4-second access to food. In this case, pigeon usually prefers this immediate small reinforcer option. Now, we have this additional key that the pigeon has to peck prior to the 2 keys. Whereas the pigeon pecks its key and the 10-second delay where nothing happens starts. And after 10 seconds delay, the original 2 keys show up. So now with the left key, pigeon has to wait a total of 10 seconds in order to access for food, in order to access the food for 2 seconds, and total of 14 seconds in order to have access to food for 4 seconds. In this case, pigeon preference shifts to the right key. So you see how the manipulation of the delay to reinforcer affects the preference, even among pigeons. we can use a computerized hypothetical task, a monetary task, for investigating preference shift with humans. So $800 now versus $1,000 in a day. Which would you prefer? I like $1,000 in a day. So are you? $700 now versus $1,000 in a day. We still like $1,000, even more. But if a $900 now, or even more than $900 now versus $1,000 in a day, some people, depending on the circumstance, may shift their preference to the immediate option. When this preference shift occurs, we call that as indifferent point. The subjective value of the immediate amount becomes equal to the subjective value of the delayed amount. And we would repeat this type of session across different lengths of delay, and we would map the indifference point across different lengths of delay and investigate individual differences in sensitivity to delay to a reinforcer. When the preference shift occurs earlier with the shorter length of delay versus longer length of delay, we would call the person impulsive, okay? Because they can't wait that long. They want to, get money rather now than later. A group from Vermont, where I did my postdoc, University of Vermont, Warren Bickel and others, did a study applying that computerized task, comparing the impulsivity level between drug-using populations and non-drug-using participants, finding that the opioid-dependent drug-using patients were much more impulsive than control participants. And I did a study published in 2011, finding that the impulsivity level differs even among cocaine-dependent outpatients. And actually, the difference in the degree of impulsivity was reflected in the difference in the treatment response. So that was interesting. Now, this is a great segue to start talking about how the principle of reinforcement can be applied to drug-using behavior. This is a slide from NIDA, National Institute on Drug Abuse, showing that addiction involves multiple factors, not just environmental influence like we've been talking about, but also biological, genetic components all contribute to drug use behavior, causes change in brain chemistry, and lead to addiction. So we're going to focus on the environmental influence part. And let's think of an example that you've been investigating in daily life. What would be an example of drug-using behavior? Can you think of, say, something, an example?
Marijuana smoking.
Smoking marijuana. Anything else?
Doing vodka shots.
Doing vodka shots. Anything else? Snorting cocaine. Very good, very good. So all that, injecting heroin, snorting powder cocaine, these are examples of drug-using behavior. If you're conducting, especially if you're conducting community-based research, it is often difficult to find this behavior occurring in real time because especially with illicit drug use, they tend to do it not so much in public, in a private space. So what we do, especially if we are treatment providers, we often find drug use evidence or non-drug using evidence by looking for biomarkers in biochemical samples, such as breath samples, urine samples, blood samples, hair samples. Okay? And there must be some feedback or consequence after drug using behavior in order that to be maintained. So let's pick an example of drinking alcohol, because we all, socially drink time to time, unless you're pregnant. And reinforcers from drug use. What kind of reinforcing physiological consequence do you get by drinking alcohol? Relaxation. What? Euphoria. You feel good. Anything bad, aversive, that you don't like from drinking alcohol? No, hangover next day. Yeah. Psychological feedback. Feeling relaxed is sort of psychological as well. Social consequence is drinking alcohol in a bar. It's definitely maintain social network, But in case of heavy alcohol drinkers, you may actually lose family, friends, co-workers by drinking heavily all the time. And usually you lose money by drinking alcohol. But if you're a dealer or working at a bar, you could make money by dealing with alcohol. So this guy, Steve Higgins, is my postdoc advisor, very intense guy, but super smart. He thought, he was wondering whether an alternative competing reinforcer like money could compete with the drug-using reinforcer. So he did a human experiment, laboratory experiment, having 4 cocaine-dependent participants, asked them to press lever, literally press lever like the operant chamber, and offered 2 reinforcers, either powdered cocaine to snort, I don't know if you could do it now, or small amount of cash, okay? So there are 2 sessions, and it was a group average, okay? And then, interestingly, when there was no money offered, of course, everybody loved cocaine. But as the money increased from like 50 cents, it's a very small amount, $1, $2, might be a big money back then, but it's a 1994 study, but still, it's not that big. By the time the magnitude of cash became $2, everybody preferred money over powdered cocaine. This is a small experiment, but pretty powerful. So he went on and established this incentive-based intervention to encourage cocaine-dependent patients to abstain from cocaine. And in this, it's called a randomized clinical trial. So a bunch of them are cocaine-dependent patients are enrolled into this study, and half of them, everybody gets some kind of treatment, but only half of them received financial incentives on providing cocaine-free urine samples, and the other half did not. So this is a money condition. People received money, achieved 12 weeks of 3 months long of continuous cocaine abstinence. So this is a pretty intense intervention where the patients are required to come in 3 times a week and cannot miss a day, cannot provide cocaine-positive samples. They were able to achieve 3 months long continuous cocaine abstinence with receiving financial incentives, and only 6 weeks with the no money condition. And this was statistically significantly different. This approach is generally called contingency management, meaning that you don't have to use money all the time as incentives. You could use like clinical privilege, methadone take-home, dosage, privilege to use cell phone cards. You could use alternative, reinforcers, not just to money. But money is the most powerful generalizable reinforcer, and has been helpful to increase or encourage health behavior, including smoking cessation, cocaine abstinence, health visit, vaccination for infants, weight reduction, medication adherence, and all that. And not everybody, Higgins is definitely from behavior analysis background, but Volp, he's actually at Penn running a Center for Health Incentives, and he's a medical doctor. And Lagarde, these people are from public health community, nothing to do with behavior analysis. But they all came to the same conclusion that money works to increase health behavior. In contingency management, I have been using this for my maternal health interest. When I was in Vermont, I worked with pregnant women who smoked cigarettes during pregnancy. And we were able to achieve 40% of smoking abstinence at the end of pregnancy versus 10 to 15% of abstinence at the end of pregnancy with other approach. And that effect was consistent. And we also saw significant clinical effects on birth outcomes, such as heavier weight babies, low NICU, neonatal ICU admission, longer gestational age, longer breastfeeding duration among mothers who quit smoking at the end of pregnancy. So I was quite fascinated. Go ahead.
I have a question.
Yeah.
With the smoking cessation, did those women stay
Uh-huh.
quit after the baby was born?
It's a very good question. Don't actually. 80% of them relapse by the end of 6 months postpartum intervention. So that's unfortunate. But you brought up a really good point, because that's a consistent criticism by others on contingency management. Yeah, money works, but we can't keep paying them forever. Well, with pregnant populations, well, yeah, most of them, especially after delivering babies, they relapse back to their previous behavior. However, at least we made a permanent difference on babies. We saved the babies, and that's big. So after I came to TRI, I've been working with a program called WIC program, Special Nutritional Program for Women, Infants, and Children, WIC. And the head of Philadelphia WIC, Linda Kildee, has been greatly interested in increasing breastfeeding duration among Puerto Rican mothers, because they're Hispanic women in general do really well on breastfeeding, except Puerto Ricans. I don't know what happened to them. That's what I'm investigating now, that they don't breastfeed more than median of 2 weeks. That's really short, because the CDC recommends 6 months exclusive breastfeeding as opposed to 2 weeks. So we wrote a grant together, got funded by NICHD. Go ahead.
Is that different in Puerto Rico? Like, do they breastfeed more there, or is it?
Yeah, that's a very good point. U.S.-born Puerto Ricans, they don't breastfeed, but the Puerto Rico-born Puerto Ricans, they do better. They do better. Yeah, it's a very good point. Got funded and has been running this small study, very challenging, but learned a lot along the way. And my recent biggest passion on my research, maternal health research, is to encourage pregnant women to stop drinking and prevent fetal alcohol spectrum disorders, which is one of the leading cause of developmental intellectual neurocognitive disorders in the world. And I remember back in the day, I worked with an individual diagnosed as FASD, pretty severe FAS symptoms, and still remember that I was shocked to know that this was completely preventable if the mother did not drink at all during pregnancy. So now you know that I'm all over this with contingency management. Canada, Alberta has high rate of individuals with FSD for 2 reasons. One, they have First Nation pregnant population, Aboriginal pregnant population drinking a lot of alcohol. But also, Alberta province is rich. So they have very good social service network that happens to attract a lot of individuals with disabilities moving to this province. That increases the FSD rate prevalence as well. So they're very interested in FSD prevention, doing something about FSD. So we have been working together. And University of Washington, they have a network to work with alcohol dependence among American Indian populations. So they invited me to be part of their center grant to NIAAA. So, and then also I've been working with the Temple OBGYN and Minnesota Department of Human Services to put out some more grants on this approach. So this concludes my lecture today. I hope you enjoyed it. If you have any question, I open the floor to discussion.